Okay, good morning to all of you. So again, we'll recall all your previous classes, like your topic, local anesthetics, because we are going to complete your syllabus. So we should revise some of your previous units. So I'll complete that part first. Along with some new drugs, you can complete your previous one also, so that you will thorough your subject material. Okay. So these things already told you. Local anesthetics means they are applied locally to make the loss of sensation during any operations or short-term surgery. Okay. So for minor surgery, you are using local anesthetics, but for your major surgery, you are using general anesthesia, which is useful for major surgery. Means your whole body will be anesthetized. You cannot feel pain throughout the body system, but in the local anesthetics, on particular area you have to anesthetize it. You will lose the loss of, or there will be loss of sensation on particular area of your body parts. So wherever you have surgery, that part only losing the sensation, like your dental surgery or any spinal anesthesia or any dermatological disorders or any wounds like that, you are using local anesthetics. So how they are producing the mechanism? By acting on voltage gated sodium channel, so that there will be no entry of sodium ions into the cell membrane or neuronal membrane. So there are two types of membranes, neuronal membrane and cell membrane. So based on that you will feel the pain. So if there is any blockage of this channel, there will be no generation and conduction of impulse. How the generation and the conduction is taking place? Through neurotransmitters. So through the neurotransmitters, nerve impulse is generated and they are conducted throughout the body system. So that will be blocked by the local anesthetics. They may inhibit the sodium channel or they may inhibit the reuptake. They are otherwise called as reuptake, neurotransmitter reuptake inhibitors. So they will inhibit the reuptake, so that that will not utilized by the synaptic cleft. At the synapse, the neurons or neurotransmitters are not reuptake, so that there will be loss of sensation due to blockage of the impulse. Okay. So like this mechanism, two types of mechanism, maybe your sodium ion blocker, sodium ion channel blocker, or reuptake inhibitors. Okay, like this, we have already distinguished general anesthesia and local anesthesia, how they are useful. So based on that, you have to differentiate, and history, how the anesthetic drugs are discovered from the plant sources like coca plants. So generally we are using some traditional medicines that is most useful. So based on the traditional approach, you are getting some new drugs. Okay, like anti-malarial drugs. Okay, quinine. Your digital sleeps containing decoxin, which is a cardiac stimulants. All are obtained from plant sources. Okay. So you can go for research on herbal technology, that is called herbal technology. On the herbs from the plant sources, you can get the medicinal drugs. So different history of development, how it is going on, already told you. So you just go thoroughly these things, because we are going to close your local anesthetic parts. So based on the toxicity also, you have to find out the drugs. So these things you have to design based on the toxicity or based on the duration of action, onset of action. All these things you have to consider during design of a new drug molecules. So these things, whether it is irritating to the skin, so all these things you have to, these are the parameters or properties of the drugs which is required to design some new drug molecules. If you are reducing the toxicity or side effects, then the drug will be more accepted. And these things already given. So it should be sterile or it should be sterilized under heat. That is heat sterilization. It should not be any deterioration. Should not be no deterioration. Okay, just a second. Sorry for disturbance, some phone call was there. So like this, you can design your molecules, maybe star derivative or mi derivatives. So mostly star derivatives we are using. Till now we have studied up to star derivatives. Okay. Then long acting, short acting, depending on the activity or duration of actions. They are different categorized based on your route of administrations, duration of access, some ultras of acting depending on the situation. If you want some immediate activity, you can use ultra short acting. Depending on the situation, you decide short acting, long acting, or intermediate type. And these are the generalized studies. These are the benzoic acid derivatives. These are the ester forms. Okay. So these things we already discussed. Some new drugs I'll add today. So depending on the bonding, also how they are interacting with your receptors to produce good biological activities. So these things. Again, same thing. This is the reuptake inhibitor. Reuptake of neurotransmitters like norepinephrine, serotonin, dopamine. If they are binding with this receptor, they are producing the response. But they are reuptake again. Some balanced amount of neurotransmitter again reuptake by the neurons. So that will be inhibited. Okay. These are some of the side effects of your cocaine. So these drugs already we have discussed. Some new drugs will add today. Hypercocaine already discussed, SR studies, mechanism of actions. Then aminobenzoic acid derivatives like benzocaine, it is most commonly used. This is a ethyl ester of para-aminobenzoic acid. So PABA is a well-known intermediate for generating the number of drugs. Sulfa drugs or your local anesthetic drugs. So it is mostly a starting material for local anesthetics and also your sulfa drugs. So synthesis is also required for your exam point of view. So para-aminobenzoic acid you can take, go for esterification with ethanol. So whatever the side chain is there, so it is a ethyl ester of benzoic acid, para-aminobenzoic acid. So you have to use ethanol. So ethanol is a static material and para-aminobenzoic acid also static material. You go for esterification. So H and OH will be removed as water. So it will be attached OCH to CH3. Okay. So like this. Again you can go for again reduction. Suppose you want reduction of nitro group. Like this also you can get the starting material. So it is a para-nitrobenzoic acid ethyl ester. Okay. So like the static material also you can use and go for reduction. So that nitro group can be reduced to NH2 group. So here nitro group reduced to NH2. Again it produces benzocaine. So any synthesis you can get for your exam. So static material may be this one or this one also. So based on the question you give the answer. SR study same thing, your phenyl ring or aromatic ring is required for your lipophilic property. If it is a lipophilic nature, then it can cross the cell membrane or neuronal membrane. This is for hydrogen bonding. Okay, this is required for your binding of drug with receptors or any side chain present in the structure also responsible for binding of drug with receptor. And any hydrolysis of this linkage or ester bond that will cause loss of activity because it will again convert to para-aminobenzoic acid. Para-aminobenzoic acid is not having any biological activity. So that is the things you have to discuss under your SR studies. mechanism again they bind to sodium channels so that they are reversibly stabilizing the neuronal membrane and decrease the permeability of sodium ion. Means sodium ion cannot enter into the neuronal membrane so that there is depolarization of the neuronal membrane which is inhibited by the benzocaine so that there is blockage of initiation and conduction of impulse. So those things you have to discuss. Then uses. You can use for anesthetic to relieve the pain in mouth and gum. So any oral disorders. Okay, in oral cases, you can use this type of local anesthetics. Or it can be used to treat non-oral conditions like numbing pain on the skin. Is to reduce the pain on skin also you can use. And these are some of the side effects. Butamben. Why it is given butamben? Because butyl group is there. Butyl 1, 2, 3, 4. So butane, side chain is butane. So it is a 4 amino benzoic acid plus condensation of or esterification of butanol. Butanol with para-amino benzoic acid. So to produce butamben, that's the name is given butamben. Same SR studies you can discuss like this. Mechanism against they are inhibiting voltage gated sodium channel in the dorsal root of ganglionic neurons. So at different parts of the neurons they are active. So based on that they are giving the potential or activity. Okay. Based on that they are going for longer duration of actions. So like that they are designed. Then uses it is used for long duration of effect for treatment of chronic pains. It is also used as surface anesthesia for skin disorders. Okay, or in case of anum or anorectal disorders, you can use for relieving the pain. Anorectal in anus and rectum area, if there is an infection, you can reduce by using this. Okay. Then procaine. Procaine is also a local anesthetic of amino ester group. Okay, this side amino group is there. So it is a amino ester group containing local anesthetics and also a benzoic acid derivative. This is benzoic acid. So it is most commonly used in the dental surgery to numb the area. Numb is to reduce the pain around the tooth. Tooth area you can use to reduce the pain. And also is used in case of pain due to intramuscular injection of penicillin. In case of penicillin injections at intramuscular route, you have pain. So to reduce the pain, you can use procaine. So this is the thing, and this is the structure of procaine. So 4-amino benzoate. This is 4-amino benzoate because it is a ester form. If it is OH, then 4-amino benzoic acid. But it is attached with side chain. That is diethyl amino ethyl. CH to CH3 is there. Again 2 is coming due to 1, 2. Here oxygen is one functional group. 1, 2. Okay. 1 and 2. So 2 position you have diethyl amino ethyl 4-amino benzoate. Very simple nomenclatures. Same SR studies, ester linkage is required, but if it is broken, there will be loss of activity. Any side chains like your diethyl amino group or this hydrogen bonding, these are required for your binding of drug with receptor. Any aromatic ring or phenol ring is responsible for lipophilic character of the drugs. So these things you can write easily. As per your syllabus, procaine synthesis is there. So you can go for para-amino benzoic acid as a starting material. Your starting material is para-amino benzoic acid, and remaining side chain whatever there you can add here. So here you have diethyl amino ethyl. So diethyl amino ethyl you have OH here. So diethyl amino ethanol you have to go for esterification. So H and OH is released as water. H and OH released as water. In presence of sulfuric acid, you can go for You can go for esterification so that you will get procaine. So these things you can write easily in your exam. So again, it is available as a hydrochloride form. You can use hydrochloric acid. So you can treat with procaine and hydrochloric acid to produce procaine hydrochloride. Okay, these things you can discuss. Then same mechanism action, it inhibits voltage gated sodium channels and thereby inhibiting the ionic flux required for the initiation and conduction of impulses. Whatever the ionic flux means the ion, sodium ions, whatever they are entered into the neuronal membrane, they are inhibited. So that there is no initiation and conduction of impulse. So that will be again inhibiting the sensation, or they will cause sensation of pain, they will cause sensation, loss of sensation of pain. Okay, that is the final aim of the local anesthesia. You have to relieve the pain by causing the loss of sensation. Okay, it is most commonly used in dental procedure to numb the area around tooth. So in dental problem you can use. Okay, and these are some of the side effects like skin rash, hypersensitivity reaction, fever, swelling, you have joint pain sometimes, weakness, all these things are there. Okay. Next, another new drug today we can add butakaine. Butakaine. Okay. So butakaine means it is having here 1, 2, 3, 4. 1, 2, 3, 4. So dibutyl amine propyl 1, 2, 3 propyl. Why it is 3 position? Because oxygen is here functional group. Suppose 1, 2, 3. So 3 position you have dibutyl amino group propyl. This is propyl 1, 2, 3 propyl 4 amino benzoate. 4 amino benzoate. So like this you can give the nomenclature. So it is a crystalline white crystalline ester used as local anesthetic. So it is a crystalline form. Some are in liquid form, but it is a crystalline form of the drug. white in color, used as local anesthetics. So if you go for SR studies, so you have here lipophilic property like your aromatic ring or phenyl ring as a part to produce lipophilic property of the drug. This is producing some hydrogen bonding for binding of drug with receptor. These are also the side chains required for your binding of drug with receptors. And this ester linkage is most required to produce the activity. If it is breakdown by hydrolysis, so there will be again generation of para-aminobenzoic acid, and that will having no activity. There will be loss of activity. So like this, you can explain your studies. So like this, you can express. So again, you go for mechanism of actions. So again, it block the nerve conduction when applied locally to the nerve tissue in appropriate concentration. Appropriate concentration means your dose should be maintained properly. Otherwise, it will cause the side effects. So these things you should know. How when during drug of administration, you should maintain the dose. So it is applied on local nerve tissues. Okay. So that on any part of the nervous system and on every type of nerve fibers. So in any conditions in the nervous system, you can use this type of drugs. Okay, nerve fibers as well as on nervous system also you can apply this type of drugs. Okay. So it is primarily used as surface anesthetic for dental vein in case of ophthalmology, in dental case and in case of any ophthalmic problems in your eyes or eye infections, you can reduce the pain by using butadiene. Okay, so this is one of the uses. And if you go for side effects like sleepiness, muscle twitching, means you have some muscle pain, ringing in the ears, you will feel some ringing sound in the ear, changes in the vision, also low blood pressure and irregular heart rates. So these are some of the side effects. How side effects are coming due to in improper concentration. So you have to maintain the concentration of the drug while administration. Okay. Next is another drug is propoxychine. Propoxychine. Another drug is a of histotype and it has rapid onset of action and longer duration of action as compared to procaine hydrochloride. If you compare procaine, you can use this type of drug for longer duration of action and quick onset of action, that is rapid. Very speedily it will produce the action. It is used in the beginning of 1950 century during dental procedure or dental surgery they have used. But it was removed from US market in 1996. In 96 it was removed, means it was banned. Due to some side effects they have banned in USA. Okay. These drugs are banned from USA in 1996. If we will go for the structure, you have, so like this you can see. So propoxybenzoate, you see propoxybenzoate. Propoxybenzoate here, you see 1, 2, 3. So propane with oxygen, propoxybenzoate. Okay, and 4 amino. 4 part 4 amino, propoxybenzoate 2. 2 means 1, 2. Propoxybenzoate. Okay, so 4 amino, suppose 1, 2, 1, 2, 3, 4. So 2 position propoxy benzoate 4 amino. Again this side is there 1, 2. 2 position you have diethyl amino. CH2 CH3 CH2 CH3. Diethyl amino again ethyl here. So 2 position here you see 1 and 2. 2 position you have diethyl amino, ethyl, 4 amino, here 2 propoxybenzoate. Like this you decide the IPSC. So if you go for SR studies, you should have some phenyl ring or aromatic ring to produce the lipophilic property of the drug. And this is for hydrogen bonding this side, and some of the side chains present in the structure required for your binding of drug with receptor. Without binding, there is no biological activity. The drug should bind with receptors. So receptor means biological targets. Okay, or on the site of actions, they should have one receptor so that they will bind with the receptor to produce the response or biological activity. So the ester linkage is required. If there is any hydrolysis of this linkage, there will be loss of activity. So you have to maintain throughout the duration of action. After that, they can be metabolized by hydrolysis. So before metabolism, it should maintain the structure. Okay. Mechanism of action. So propoxy binds to and inhibit the voltage gated sodium channel, and thereby inhibiting the ionic flux required for initiation and conduction of impulses. So our aim is to inhibit the sodium channel so that there is no entry of ions required for initiation and conduction of impulse. And finally, it reduces loss of sensation. So there will be no sensation, so that you will not feel any pain. Next, if you go for uses, so it is combined with procaine to accelerate its onset of action and provide longer lasting anesthetic activity. So sometimes in combination therapy also it is used with procaine to accelerate the onset of action and provide longer lasting anesthetic. So for long duration of action and quick onset of action, you are combined with procaine. Okay. So for this purpose, you are using combination therapy. It was used or it was produced for the use when amide local anesthetics were contraindicated due to allergy. So some amide local anesthetic, this is a ester local anesthetic. So this is a ester form of local anesthetic. It is most useful when the local anesthetic of amide derivatives are contraindicated because they are producing some allergy or any unsuccessful of this amide anesthetics for the this type of drugs like propoxykyne. Okay, so these are some of the uses. And so metabolism, they are metabolized or hydrolyzed in both plasma and also liver by plasma esterase. By the enzyme plasma esterase, sorry, it is metabolized in both plasma and liver. So enzyme is esterase. Okay, and some of the side effects like broad vision, redness. Okay, these are some of the side effects: sensitivity to light, severe stinging in the eye, tearing, thrumming, eye pains. So all these things observed as a side effects. Okay. Next we'll go for another drug, that is tetracycline. Tetracycline. So it is also a benzoic acid derivative, tetracycline, and it is also known as amethocycline. The other name of tetracycline is amethocycline. It is also applied to the skin before starting an intravenous to decrease the pain from the procedure. Suppose some surgery purpose you are using some intravenous injections. So before that you can use this drug to reduce the pain. Okay. Typically it is applied as a liquid form. It is available, or in ophthalmic purpose it is used. For eye, nose or throat it is used to numb. Numb means to reduce the pain. Used to reduce the pain on eye infections or nose or throat. You can use this type of drugs. It is available in liquid form. Okay, in injection form or in the drops. You can use this type of drugs. So it is a potent local anesthetic of Easter type used for surface and spinal anesthesia. For surface and spinal purpose, it is used. It is a long-acting Easter anesthetic. So tetracycline is a long-acting. Okay. So if you go for your IPSC name, you can see here. This is benzoate, then 4-butyl amino. This one. 1, 2, 3, 4. 4-butyl amino. Plus 4 position it is attached. 4-butyl amino benzoate. Then this side you see 2 position, 1, 2 position. You have dimethyl amino. This is methyl group. Dimethyl amino ethyl. This one. Okay. So 2 position, 1, 2. 2 position you have dimethyl amino ethyl. Then 4 position butyl amino benzoate. Okay. Like this you can see. If you go for SR studies, presence of some aromatic ring is required for your binding, your lipophilic property of the drug. This is for hydrogen bonding with side chain, required for your binding of drug with receptors, and the sister linkage is required for your potential activity. If it is breakdown during your hydrolysis, then it will loses the activity. So up to metabolism, it should be maintained. After producing the activity, it can go into the metabolic process and hydrolyze. That is not no problem. Upon administration, go for mechanism. Suppose upon administration, tetracycline reversibly bind to the voltage-gated sodium channel in neuronal cell membrane and inhibit the sodium influx. Influx means entry of sodium ion into the cell membrane. So it will be inhibited. Due to this, there will be prevention of initiation and conduction of nerve impulse and stabilize the neuronal membrane. So there will be again loss of sensation of pain. Okay. So this is the mechanism of tetracycline. For uses, they are used for eye drops to numb the eye before surgery. Suppose there is any ophthalmic surgery, you can use this type of drugs to reduce the pain. It works by blocking the pain signal at the nerve endings in eye. So in the nerve endings, they will block the signal, pain signals. It is used mainly for topical, sometimes spinal anesthesia. So that's why it is called surface anesthesia or spinal anesthesia. On spinal cord also you can inject for anesthetic purpose, or you can use on surface, skin surface. Okay. Then some of the side effects like blurred vision, redness of the eye, sensitivity to the light. Okay. Any severe stinging in the eye, tearing, throbbing eye pains. So these are some of the common side effects with other drugs also. So you can remember for your exams. Next, another drug is benoxynate. So this is otherwise called as oxybuprocaine. Oxybuprocaine otherwise called benoxynate. Same, but name is different. Okay, and symbolized at P and X. It is a Easter type of local anesthetics, mainly useful for ophthalmology and otolaryngology. Means auto means for ear and larynx. Okay, both are interconnected. For that also you can use like ENT, eye, nose, and tongue, like that. ENT department. So ophthalmology means for eye treatment or for ear and your larynx. Both are interconnected. For that also in your surgery. Suppose tonsillitis is there, tonsillitis operation is there. You can use this type of drugs. So this drug was first sold by Novartis under the brand name Novacin or Novacin or Novacin. Okay. So first it was sold or marketed by Novartis. It may be less irritating than tetracaine. So it is less irritating, and the onset and duration of action similar to tetracaine, but less irritating. Okay. So it is somewhat advantage than tetracaines. And this is the structure with nomenclature. You can go for here butoxybenzoate 1, 2, 3, 4. So 4 carbon means butane with oxygen, butoxybenzoate. Then 4 position amino group, 4 amino, 3 butoxybenzoate. Then you will go for 2 position, 1 and 2. Diethyl amino. Here you see diethyl amino. CH2, CH3, CH2, CH3 means diethyl amino ethyl, and 2 position means 1, 2. Ethyl 4 amino, this one 3 butoxybenzoate, like this. Again same SR studies. So you have here NH2 ring means amino group is there. So here hydrogen bonding with side chains required for binding of drug with receptors. Here this is for lipophilic property and ester linkage. So this is also required for your activity. If it is breakdown, there will be loss of activity. Again, mechanism of action, it binds to the sodium channel again and reversibly stabilize the neuronal membrane, which decreases its permeability to sodium ions. So if it is stabilized, there is no permeability. So the sodium ion cannot enter the cell membrane or neuronal membranes. So if it is not entered, there is depolarization. So it is inhibited and thereby block the initiation and conduction of nerve impulse. So generally it is almost similar type of mechanism of action, but it is written in different terminology. Okay, you can use it enables sodium ions or sodium channels, voltage gated sodium channels, so that there is blockage of initiation and conduction of nerve impulse, so that there will be loss of sensation. Simple things you can write in your exams. Then it is used to numb or block the feeling of pain in your eyes during short-term procedures or short-term surgery in your eye. So for ophthalmic operations, you can use this type of drugs. And some of the side effects like eye irritation, any conjunctival redness will be there in the eye, contact dermatitis on fingertips, and allergic reactions. Sometimes it is rare. So these things you have to remember for your exam point of view. Okay. So these are all about your drugs under local anesthetics, benzoic acid derivatives. So up to this we will conclude. So any doubts you can ask the questions so that I will clarify your doubts. So today I send this material, you read thoroughly. Only you have to remember the structure with nomenclature, some mechanism, SR studies, and some are having some metabolisms. Like this you have to remember. Okay, so that you can write easily in the exam. You have to give your attendance. Okay, all of you given your attendance. So read thoroughly. I'll send you the material now. You read thoroughly. Any doubts you can ask me. So we'll conclude the session today.